Rodney. I'm a clinical assistant professor at Texas Southern University College of Pharmacy and Health Sciences. And I'm also the program director of our Breast Cancer Screening and Prevention Center that's funded by Susan G. Komen.
Postman. Who this?
Walk, leash, walk.
When should you be screened for breast cancer?
So frequent questions that we get while doing our events with the Breast Cancer Screening and Prevention Center is, when should a woman be screened for breast cancer? The women are broken up into two major classes, average risk and women of higher risk. To go over the women of average risk, at 40 years of age is the normal recommended screening age for women to start receiving their mammograms. Women of higher risk, which are characterized by women who have a history of DCIS or LCIS, which are basically small microscopic tumors that are in either the lobes of the breast or the ducts of the breast, as well as women who have had radiation to their chest wall between the ages of 10 and 30, and also women who have at least a 20% increased risk of breast cancer due to their family history, and finally, women who have the BRCA1 and 1 or 2 mutation all have a more aggressive screening recommendation. Those women should start screening at age 30.
What are some risk factors for breast cancer?
Age, as well as gene mutations, patients' eating habits, their health history, the density of their breasts. There's a host of different things that go into us assessing the risk of a patient developing breast cancer.
What to look out for on a self-exam?
Clinical breast exams are actually performed by healthcare professionals, while breast self-exams can be performed at home. In reference to breast self-exams that women perform at home, whether it be on a monthly basis or a weekly basis, women should be looking for changes in the look or the feel of the actual breast, changes in the look or the feel of the nipple, or nipple discharge. Frequent question that we get asked during our events is, what's the difference between a diagnostic mammogram and a screening mammogram? Screening mammograms are essentially the start. A patient who has a diagnostic mammogram, they're usually going to have more images that are available to be evaluated by a radiologist compared to the screening mammogram, which will be the start of possibly finding that hyperdense area on the breast that looks suspicious for breast cancer. Breast cancer can't be officially diagnosed until a patient receives a biopsy. So this is like the start to the finish if a patient is diagnosed with breast cancer. One positive thing about breast cancer, although you have almost 270,000 patients being diagnosed with breast cancer just in the United States in 2019, is that most breast cancers are actually identified at an earlier stage, so they're easier to treat. In the United States, there's an estimated 268,000 cases of new breast cancer that we diagnosed in 2019. Of those 268,000 patients, it's estimated that 30% of those patients will actually develop metastatic breast cancer. And there are about 155,000 women living with metastatic breast cancer in the United States as of 2017. When you look at the goals of some of the large organizations like Susan G. Komen, they've set a very, very aggressive goal of decreasing the mortality due to breast cancer by 50% by 2026. Furthermore, when you go to some of the minority data that's available, there is minority data that say that African American women have a 40% higher chance of dying of breast cancer compared to their Caucasian counterparts. Texas Southern University's Breast Cancer Screening and Prevention Center is actually partnered with KnowYourGirls.org, which is an organization that directly targets African American women and actually increasing their awareness of breast cancer and really understanding the increased risk they may possibly have from developing breast cancer. That increased risk of dying compared to their Caucasian counterparts in reference to breast cancer is 40%. So it is a large number, and it could be associated with a host of different things, whether it be access to breast cancer screening to catch breast cancer at an early stage, or actually the funds and the resources once a woman is diagnosed with breast cancer. That becomes very important, as it is very expensive to treat breast cancer. The primary objective of the grant is definitely to screen patients who are uninsured or underinsured that are African American, but it moves further than that. We also want to navigate patients to the screening. So even if they don't receive their screening from our grant, we want to help them get the screening at their healthcare institution of choice. Once a patient has an abnormal screening that's been screened with our breast cancer grant, we do actually help navigate them to the roads to help them get the actual diagnosis of breast cancer, or at least get a comparison of what had happened previously. Furthermore, with the Know Your Girls campaign, the KnowYourGirls.org campaign, they've really worked well in the community to help with some of these outside screenings of African American women. I come to you bearing greetings during Breast Cancer Awareness Month and to invite you to some of our screening events for some of our uninsured patients and underinsured patients. We have 3 events that are coming up in the next month. We have one event at Good Hope Church that's on October 26th. We have another event that's coming up at Avenue 360 on October 28th. And we have another event that's coming up at Good Hope on November 23rd. For more information in reference to those events, please email us at tsubreastcareclinic@gmail.com. The Rose and Memorial Hermann are also good resources to gain screening in the community. Once again, if you want more information about that, you can definitely email us at our email